he's got almost everything. The Solea, he's got CAD CAM, he's got 3D printing, he's got CBCT, and I think the power and the synergy of all of those things working together and being able to offer everything under one roof is pretty unique, because we have a lot of customers that have a few of those things and can have great benefits, but just like his lab shows here, it's really a centerpiece of what he does, and it communicates well to patients of how seriously he takes their treatment and how much he, enjoys his profession and being at the top level. Because I would say he's probably in the top 1% of dentists. Not many people have all of these things to offer.
I bought the office in 2015, and 5 years into it, I was up for a lease. The current side that I renovated was available, and so I was either going to just renovate the one side and make that nicer or expand. And, we were fortunate enough to be really busy. So the expansion process seemed like a better idea at the time. Plus we had so much technology, but we had it hidden in every corner of our old office. Our mill was in sterilization. My cone beam was in my personal office. So we just needed the space. And so the idea of the renovation was to put the lab in the way of the patient when they were walking in, so they would just see it when they came through. So it would just start the conversation of the type of dentistry that we do here. Why I like Solea, or why I use Solea, is it makes my dentistry clinically better. As it cuts, it's so clean. Everything that you do is visible again. So as far as the type of dentistry you do, it makes your dentistry better. It also makes it more efficient, so it's faster. So we're able to do more dentistry in a faster amount of time. I think 3D printing is probably going to have the most evolution. It's where the companies are putting the most sort of R&D for new resins, things of that nature. So what we do 3D printing in our office for, we print models for study models. We print models for retainers, for clear liners. We do surgical guides. So the amount of things you can do with a 3D printer is just immense, and they're getting more and more. More companies are doing digital dentures, so you're printing the denture instead of doing it the old-fashioned way. That's pretty much where everything is going along that line. So as far as a 3D printer, that seems to be the best kind of return on your investment with the amount of different procedures and different things you could print with it. I think the biggest benefit is just a patient conversion to it. The easiest way to convert a patient to treatment, and the ability of seeing, it's like a picture is worth 1,000 words. Seeing it on the screen is, they're like, well, yes, let's fix that. We have to give bad news all day. So I hate giving bad news. I hate telling people they have cavities. I hate telling people they have a broken tooth. It just gives you cover, because you're like, this is your tooth, this is your cavity, this is broken through, and look at it. And again, they just are like, well, can we fix that? And before Pearl, when I told them they had a flossing cavity, they were never like, oh, what can we fix that? Like, they were like, well, what does that mean? But so seeing the cavity, colorized, growing in between their teeth just helped them realize that they need to fix that.
I think it starts more as a holistic approach when done right, and starts with the territory rep first, having conversations about what the doctor's long-term goals are and their vision for their practice, because it's not always about production. It might be about lifestyle and some other things. So you need to know that first. So it definitely starts with exploring and fact-finding, and then coming up with some kind of tailored solution, and then helping them walk through it. These are some of the biggest investments that they're ever going to make in their careers, and they're really scary. They need sometimes someone who's seen this be successful a bunch of times to say, no, it's going to be fine. We'll walk you through it. We'll be there the whole way. We're not just going to put something in and walk away. We'll help guide you through the whole thing.
We sat down, kind of put a plan together, listened to his vision and his dream. And the way that we kind of approach that is, hey, build your dream office. And then without thinking about the budget, let's, go all out. And then we'll talk about budget and we can reel it back in, but just build your dream office. And I think that's what we helped him achieve.
As far as Patterson goes, I just really see them as a value partner. I see them as, Sean as a business partner, if you will. Most of my business decisions, most of my technology decisions, I, bounce off him. He's been, sort of a liaison between the two. And so as far as a partnership there, I just, think Patterson is just the head and shoulders above the rest.
I think our part is to be a good listener and to be a good business partner and say, hey, I think we should look at this technology. I think this is going to help get you to that next goal.